Health systems tend to be slow to react, and we must seize this moment to utilize the COVID-19 crisis as a catalyst to durably improve our health systems. We cannot continue to treat each epidemic as a one-off, a unique crisis that gets followed by indifference. The COVID-19 pandemic has demonstrated the need for health systems to be resilient and adaptable and leverage existing platforms to respond to new needs. A great example of this is that over the last 30 years or so, the global ability to do virologic testing for HIV using advanced molecular diagnostics has expanded broadly. These same machines that we utilize for diagnosing HIV have been adapted for diagnosing COVID-19. And this is an excellent example of how existing infrastructure can be leveraged for new uses. The COVID-19 crisis has re-demonstrated the fact that health systems are truly part of a nation's security apparatus. It brings to mind back in the year 2000 when the United Nations Security Council correctly declared that the HIV/AIDS pandemic was a global security threat. That designation, both in the United Nations and within the United States government, helped pave the way for the flow of resources to counter that threat. Ensuring that these systems are resilient and adaptable will require investments in personnel, in training, in leadership, and supply chains. Another example from the world of HIV is community HIV testing and contact tracing. While these diseases are vastly different in innumerable ways, we can utilize some of the approaches and systems to confront COVID-19. By the same token, the infrastructures we have developed for childhood immunizations, for TB, and for other health threats and public health challenges must be leveraged if we hope for sustainability in improving our capacity to respond to emerging threats. Finally, we find ourselves in a moment where information technology advancements enable our health systems to reach out to populations and perform in ways we could not have imagined just a couple of decades ago. We have seen with the COVID-19 response in countries around the world that telehealth has been used to provide services to patients without them having to come into overburdened health facilities. Investments in telehealth systems can result in significant savings for patients and health systems. It is important that we, one, strengthen our health system to confront the COVID-19 pandemic. Two, we must emerge from this crisis with health systems that are adaptable and resilient. Three, we must ensure the political will and ongoing funding to make sure that the positive changes that we've seen are durable.